All right, good afternoon, everyone, and welcome back to another live video here from In a Heartbeat. I hope everybody had a good weekend. It's actually snowing here in Connecticut. I think the first day of spring was on Friday, but we're getting some snow today. Today's video, I'm going to talk about our Hypertrophic Cardiomyopathy research funding program. I'm going to kind of tell you all about that, what we've done with it, and where we're trying to go with the program. Before I start, just a reminder, last week, the last video that we shot was some information about our AED donation program, which does happen to be our most popular program. We talked about what we do, what we've done, where we've donated, and most importantly, how to apply. So again, if you know any organizations that are in need of an AED or could benefit from any of the services we offer, please feel free to pass our information along to them or have them reach out to us, and we'd be happy to help as soon as we possibly can. Okay, so today we are going to talk about our Hypertrophic Cardiomyopathy research funding program. And before I do that, I am going to talk about hypertrophic cardiomyopathy and what it is, so you have a better understanding of the program and why we're doing the work that we do with it. So again, like I said in one of my previous videos, I'm not a doctor. I am not a medical professional, but I am a hypertrophic cardiomyopathy patient, and I have learned a lot about disease over the course of time. And I'm going to kind of talk about what it is, some symptoms, what to look for, the different types, the treatments, and this is all information that, of course, I've learned being a patient, and I've learned from my doctors and learned from reading articles and different studies about HCM. So hypertrophic cardiomyopathy, also known as HCM, is a fairly common disease. It affects approximately between 1 and 200 to 500 people. Studies recently said that it would... Studies recently said that it was about 1 in 500, and most recent studies say that it's actually affecting more about 1 in 2 to 1 in 500 people. So it affects people of all genders and all races. And basically what it is, it's the excessive thickening of the heart muscle. And this thickening occurs most frequently in the septum. And the septum of the heart is the muscular wall that separates the left and right lower chambers of the heart. So that's where the thickening occurs. There's two types of HCM. One is obstructive, and this is the most common type of hypertrophic cardiomyopathy. About 2/3 of patients that have HCM also have obstruction as well. And basically, what obstruction does is it obstructs the flow of blood out of the heart, and these patients can suffer from more day-to-day symptoms than patients that don't have obstruction. And some of these symptoms might include shortness of breath, chest pain, and lightheadedness. The second type of HCM is non-obstructive, which is patients that have a thick heart, but they don't have any blood flow obstruction. So some symptoms to look for, and this is really important because if you or someone you know or someone you love, someone you're friends with is experiencing any of these symptoms, our suggestion is to get seen by a doctor as soon as possible. So some symptoms of HCM and other heart disease to look for: shortness of breath, chest pain or tightness or pressure in the chest, general fatigue, more so than normal, heart palpitations, which are sudden forceful heartbeats, lightheadedness, dizziness, fainting, and lost consciousness. Those are all symptoms of HCM and other heart disease. And again, if you're experiencing any of these symptoms, you need to be seen immediately by a doctor. A couple tests that a doctor might put you through, if you're showing these symptoms and you go see them, and they might put you through different tests to help diagnose what's causing these symptoms to occur. First test is an electrocardiogram, also known as an EKG or an ECG. And this is basically a snapshot in time of the rhythms of your heart. So it's a really quick, simple, painless test. From there, they're probably going to give you a echocardiogram, also known as an echo. They might do a stress test with an echocardiogram, cardiac MRI, cardiac catheterization, and use all these tests together to diagnose you or someone with with whatever condition is causing you to have these symptoms. There's different treatment for HCM. The first treatment that doctors are going to use is probably medication, and try to see if a beta blocker, which can lower the symptoms, and see if it does that. If not, patients that have obstruction, if the medication and beta blocker doesn't work, doctors might suggest getting a surgical myectomy or a alcohol ablation. And the last treatment for HCM is an implantable cardioverter defibrillator, which is also known as an ICD, and can be implanted surgically in the chest, and essentially works as an AED would, except it's inside your body. It reads rhythms, and it determines if your body's in a dangerous rhythm, and it would shock your heart immediately back, ultimately saving your life. So those are the different types of treatments for the disease. So that's just kind of some general information about HCM and heart disease, and just so you have some knowledge about this program and what we're doing with it. Now I'm just going to talk briefly about what we do. So our HCM research funding program, basically what we're doing is we're providing support to research projects that focus specifically on hypertrophic cardiomyopathy. So these projects can include anywhere from genetic testing to treatment, medication, really any research that is going to improve the overall knowledge of the disease, help patients stay safe, and also help patients live as long and normal a life as possible. Because, and we'll talk about this in some upcoming videos, but one of the things about heart disease is, as scary as it is, patients can have a really normal life. And the more knowledge that our doctors and researchers have about the disease, the more normal patients' lives are going to be able to be had. So that's basically what we're trying to do with the program. So far, what we've done is we made our first donation for research back in 2016. We made a $6,000 donation. In 2017, we donated $8,000. In 2018, we donated $11,000, and in 2019, we donated $10,000. So in total, we've donated $35,000 of research money to different centers that provide research on hypertrophic cardiomyopathy. We're really proud of the work we've done. We're going to try to continue to make a donation each year to a project that's going to help the overall knowledge of the disease. So that's our information on our HCM research funding program. Again, if you are connected with anybody that this program could benefit, please feel free to have them reach out to us or send our information to them. We'd be happy to help anyone or any research project if we are able to. Going forward with our next videos, our next live video, we're going to talk about our patient support program. And in addition to that, we're going to be uploading some videos with some information about our board of directors, so you can get to know the people that help us do the work that we do. We're going to be uploading some videos on some inspiring stories from patients that live day to day with heart disease, or that have gone into cardiac arrest and have had an AED save their life. And we're also going to be uploading some videos on with some testimonials from some organizations that we've donated to. So thank you all for taking the time to listen, and we'll talk to you soon.